Hey guys, it's me Chase. I'm here to talk to you a little bit about what exactly is psychotherapy or psychoanalysis. So, for what exactly is psychotherapy? If you remember back to the beginning of the semester when we talked about more of the foundational stuff for the field of psychology, you'll remember a guy named Sigmund Freud. Now, Freud is considered by a lot of people to be kind of the father of modern psychology. He laid the groundwork and the foundation for what the field and what the study was going to go on to become. Freud had this theory about how the human consciousness operated and was divided. A lot of modern psychologists, and I think even Freud himself, characterized this or illustrated it in what people are calling the iceberg model, where you've got three sections that all can be compared to an iceberg, where you've got one piece sticking out just above the ocean, and the whole rest, large portion of it, is all underwater. So with that in mind, three areas of consciousness that Freud theorized was there is the ego, the superego, and the id. Now, what exactly are those? Well, the ego is that tip of the iceberg, that little bit sticking above the water. That's the consciousness, what we're actually aware of. It is our sense of self, it is our personality, it is our idea of social constructs and how to actually operate and conduct ourselves in society in a way that we think would be deemed appropriate by others. At the opposite end of that, you've got the id. The id would be the deepest part of the iceberg, very unseen, hidden by the water. And the id is very animalistic. It's driven by desires, by getting whatever it is we want in a very animalistic style way. It's very, very selfish, whether it's food, whether it's any sort of pleasure, whether it's any sort of sex. The id is focused on gratification whenever it wants it, in the way it wants it, exactly how and when it wants to have it. So there's two really big discrepancies there between the ego and trying to operate in society in a way that others would deem appropriate, and this really strong id that says, no, give me what I want when I want, and I don't really care about anything else. So in a way to kind of balance those two out, you've got the superego, still below the water, still below that threshold of perception and what we're actually consciously aware of. But Freud would say that this superego is kind of a balance between the id and the ego, and would serve a lot of other functions in Freud's theories as well. But in its most basic form, essentially it is a collection of both rational societal constructs and pure pleasures that mix together and kind of serve as a balancing between the ego and the id, as a way to kind of keep those in harmony and prevent this eternal struggle between in our minds between this ego and this id. So Freud believed that really in order to help somebody with their psychology, with the way they think, you had to understand what it was that motivated them to do the things they were doing or to think the way that they were thinking. And with Freud, his pretty much all of his theories, all of his hypotheses boiled down to it was some sort of sex. What drove people, what was really a driving factor for individuals was sexual desires, whether largely because his theories were all focused on motivation by pleasure, and Freud theorized that sex was one of the most universal pleasures amongst human beings, that everybody wanted some sort of sexual gratification. Now, as psychology grew and developed, people began to shift away more and more from Freud's ideas, mainly because they couldn't be tested and disproven. There was no way to scientifically measure what it was that Freud was doing, and there was a lot of question as to scientific validity of some of the tests that came from Freudian psychoanalysis. And so that led to some of the more behaviorist and cognitive realms of psychology that we know about, that we have today. But it all is rooted in that psychoanalysis. Today, people are actually have moved back towards psychoanalysis, and they've developed ways to back them up a little bit more. They've tweaked the theories of quite a bit to fit the modern findings, to fit modern populations, in order to really better understand and better treat individuals. So a big deal with modern psychoanalysis is a focus on humanistics, a focus on what it is about that specific individual. So whereas Freud would say pretty much everyone everywhere is motivated by sexual desires, by a need for sexual gratification, modern psychoanalysis would focus more upon what it is that specific individual was motivated by. So while there may be some people who are focused on getting sexual gratification, and that's why they go out and try to get a job, that's why they go out and do things that they do, or that's why they think the way that they do, there's a lot of other theories about why people are motivated to do the things they do. Some people, it is just for relationships. They just want close, personal relationships with people, and that is what motivates them. If you think back to when we talked about sex and sexuality in class, remember Dr. Hockett explained that there are some people with very little to no sexual drive at all, and that's a perfectly normal thing for them. So those individuals would not have this immense drive for sexual gratification that would motivate them to do things while they're still highly motivated individuals. So that's kind of the theme behind modern psychoanalysis, is that while that may work for a handful of people, human desire and human motivation is so much more complicated than just people wanting sexual gratification. And so that leads to a lot more diverse understandings of motivation, which can also be tricky if you're taking this from a therapeutic approach and trying to understand how you can use that motivation to advance somebody's therapies. So in that sense, psychoanalysis or psychotherapy is talk therapy. It is very similar to what you would see on a lot of television, of the kind of stereotypical, you've got the therapist sitting in a big armchair and the patient lying on the couch and just sitting there talking about whatever it is that's on their mind or whatever is bothering them. Actual real-life psychotherapy is a little bit similar to this. It's a lot of talking and back and forth between the patient and the psychologist. It's focused on making that patient as comfortable as they can possibly be. So whatever positioning that puts them in that state, whatever dynamic between the two would help put them in that state, because the goal is to get them to be open, to get them to discuss any thoughts they have, any feelings they have, so it can give that therapist an insight into that person so they can understand their motivations, their desires, and how they can use that to better assist with whatever problems that person is having. For example, if somebody was struggling with, let's say, anxiety or depression, and they were having some sort of psychotherapy, the goal of the psychotherapy would be to understand why they are experiencing these feelings of anxiety. What about them? What about their past? What about their present lives are causing, maybe externally or internally, them to experience these heightened states of anxiety? And then using that knowledge to better understand why they're feeling the way they do, so that understanding can hopefully lead to a more effective treatment. Some form of talk therapy or psychotherapy is suggested by almost universally among psychologists and psychiatrists should be accompanied with any sort of treatment for mental disorder, whether it's a personality disorder that's heavily treated with psychotherapy, or a schizophrenic or mood disorder such as anxiety or depression, where we have more sophisticated drugs to treat. You'll very rarely, if ever, find a psychiatrist or a psychologist who ethically would want to just prescribe you medication with no form of therapy, because generally all the medication is doing is going to mask or dilute the symptoms. It's not going to do anything to treat the root cause. With psychology, with it being so much in our minds and how we think and behave, and because that's so much more complicated than just chemical interactions, and electrical signals within our brains, those medications are extremely important to treating those disorders, but also understanding and discussing and talking about those problems is very, very crucial to actually treating them and to getting to a point where the patient or the client or anybody with any sort of psychological issue can actually go forth and solve those problems. So I just want to leave you guys with this. Psychotherapy is a very, very important part of psychology. It is where we came from, and it is where psychologists have gone to integrate back into just about every form of psychology. Even in neuroscience, there are traces of trying to understand why psychotherapy works the way it does. So even the most scientific, hard science, biologically based areas of psychology are still have some roots in the more mental, philosophical realms of psychoanalysis. Keep in mind that these services are readily available at Washburn. If you ever have any sort of issues, or you know of anybody who has some sort of issues that you think just talking about can help, there are free services at Washburn. That's all available online. Dr. Hockett has always listed that in her syllabus, so if you need a phone number, a website, there's national services, there's free clinics available here at Washburn's campus. There are always professors who are willing to listen to any problems you might have. They may not actually give you any sort of input or advice depending on what the problem actually is, but there are many, many professors, especially in the psychology department at Washburn, who are more than willing to listen to you, to give you some sort of guidance, and to help maybe get you, if they believe this sort of type of therapy or some sort of professional help would assist with your problems. They're very well equipped to recommend and to get you into where you need to be to help with those kinds of problems. So with that in mind, I hope you all had a great break. I hope this video was informative, and I hope you all do excellent on this last exam. Have a good day.